Hi and welcome viewers of Nursing Academy 101. In this video we will talk about the challenging NCLEX-RN and Prometric questions related to pediatric nursing, along with the answers and rationales part 3. But before we start, please, do not forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question 1. A 2-year-old child with a history of Down syndrome is admitted to the pediatric unit with acute respiratory distress. The child's oxygen saturation is 88% on room air. Which intervention should the nurse prioritize? A. Administering oxygen via nasal cannula. B. Providing respiratory treatments with bronchodilators. C. Initiating chest physiotherapy. D. Placing the child in a high Fowler's position. Answer. A. Administering oxygen via nasal cannula. Rationale. In children with Down syndrome, there is an increased risk of developing respiratory infections and complications due to anatomical differences and weaker immune systems. Oxygen saturation of 88% indicates hypoxemia and requires immediate intervention. Administering oxygen via nasal cannula will help improve the child's oxygenation and overall respiratory status. Question 2. A 10-year-old child is prescribed methylphenidate, Ritalin, for attention deficit hyperactivity disorder, ADHD. The nurse is educating the child's parents about the medication. Which statement by the parents indicates a need for further teaching? A. We should give the medication before breakfast. B. It's essential to monitor our child's height and weight regularly. C. If our child has trouble sleeping, we can give the medication later in the day. D. We will watch for any signs of tics or facial grimacing. Answer. C. If our child has trouble sleeping, we can give the medication later in the day. Rationale. Methylphenidate is a stimulant medication commonly used to treat ADHD. It can cause insomnia and disrupt sleep patterns, so it is essential to administer the medication in the morning to avoid interference with the child's sleep at night. Question 3. A 6-month-old infant is admitted with suspected intussusception. The nurse should monitor the infant for which classic manifestation of this condition? A. Hypertension. B. Current jelly-like stools. C. Projectile vomiting. D. Hypoglycemia. Answer. B. Current jelly-like stools. Rationale. Intussusception is the telescoping of one part of the intestine into another, leading to intestinal obstruction. A classic manifestation of intussusception is the passage of current jelly-like stools, which contains blood and mucus. The child may also have severe abdominal pain, and a palpable sausage-shaped mass may be felt in the abdomen. Question 4. A 4-year-old child is diagnosed with nephrotic syndrome. Which finding should the nurse expect when reviewing the child's laboratory results? A. Hyperalbuminemia. B. Hypoalbuminemia. C. Hyperkalemia. D. Hypercalcemia. Answer. B. Hypoalbuminemia. Rationale. Nephrotic syndrome is characterized by increased glomerular permeability, leading to the loss of protein, especially albumin, in the urine. This results in hypoalbuminemia, which can lead to generalized edema due to decreased oncotic pressure. Question 5. A 14-year-old adolescent is admitted with suspected appendicitis. Which assessment finding is of most concern to the nurse? A. Rebound tenderness in the right lower quadrant. B. Pain that started around the umbilicus and migrated to the right lower quadrant. C. Positive Rovsing sign on examination. D. Reports of pain relieved after passing gas. Answer. A. Rebound tenderness in the right lower quadrant. Rationale. Rebound tenderness in the right lower quadrant is a concerning finding in suspected appendicitis. It suggests peritoneal irritation and inflammation. The nurse should report this finding immediately, as it may indicate a worsening condition and the need for urgent surgical intervention. Question 6. A 2-month-old infant is brought to the emergency department with a fever of 101.5 degrees Fahrenheit 38.6 degrees Celsius. The infant appears irritable and has poor feeding. The nurse suspects sepsis and prepares to obtain blood and urine samples for cultures. Which action should the nurse prioritize? A. Administering antipyretics to reduce the fever. B. Initiating intravenous fluid resuscitation. C. Placing the infant in isolation to prevent the spread of infection. D. Swaddling the infant to provide comfort and reduce agitation. Answer. B. Initiating intravenous fluid resuscitation. Rationale. In infants suspected of having sepsis, fluid resuscitation is a priority to maintain perfusion and prevent dehydration. Obtaining blood and urine samples for cultures is essential to identify the causative organism, but fluid resuscitation takes precedence in stabilizing the infant's condition. Question 7. A 5-year-old child is scheduled for a tonsillectomy and adenoidectomy. The nurse reviews the child's history and notes that the child had a cold with a mild fever 2 days ago. What action should the nurse take? A. Inform the surgeon and anesthesiologist about the recent illness. B. Advise the child to drink plenty of fluids to stay hydrated. C. Administer prophylactic antibiotics to prevent infection. D. Instruct the child to use a saline nasal spray to relieve congestion. Answer. A. Inform the surgeon and anesthesiologist about the recent illness. Rationale. A recent upper respiratory infection can increase the risk of complications during tonsillectomy and adenoidectomy. The surgeon and anesthesiologist should be informed so they can assess the child's condition and decide whether it's safe to proceed with the surgery or postpone it until the child has fully recovered. Question 8. A 12-year-old child is diagnosed with type 1 diabetes mellitus. The child and their parents need education about insulin administration. What should the nurse include in the teaching? A. Insulin should be stored at room temperature. B. Rotate injection sites within the same anatomical area. C. Mix short-acting insulin with intermediate-acting insulin in the same syringe. D. Administer insulin as soon as the meal is finished. Answer. B. Rotate injection sites within the same anatomical area. Rationale. To promote proper insulin absorption and reduce the risk of lipohypertrophy, thick and fatty tissue at injection sites. It is important to rotate injection sites within the same anatomical area, example, abdomen, thigh. Short-acting insulin should not be mixed with intermediate-acting insulin in the same syringe. Question 9. A 7-year-old child is hospitalized with acute glomerulonephritis. The nurse should monitor the child for which complication related to this condition. A. Hyperactivity and restlessness. B. Hypertension and periorbital edema. C. Excessive thirst and polyuria. D. Diarrhea and abdominal pain. Answer. B. Hypertension and periorbital edema. Rationale. Acute glomerulonephritis is characterized by inflammation of the glomeruli in the kidneys. Hypertension and periorbital edema are classic manifestations of this condition due to fluid retention and impaired kidney function. Monitoring blood pressure and assessing for edema are crucial aspects of the nursing care for a child with acute glomerulonephritis. Question 10. A 3-year-old child is brought to the clinic with a chief complaint of persistent vomiting and coffee ground emesis. The child appears pale and lethargic. The nurse suspects gastrointestinal bleeding. Which action should the nurse take first? A. Start an intravenous line and administer fluids. B. Check the child's vital signs, including blood pressure. C. Obtain a detailed history of the child's diet and recent illnesses. D. Perform a thorough abdominal assessment to assess for tenderness. Answer. A. Start an intravenous line and administer fluids. Rationale. In a child with signs of gastrointestinal bleeding, fluid resuscitation is a priority to address hypovolemia and maintain perfusion. The child's pale appearance and persistent vomiting indicate the need for immediate intravenous access and fluid administration to stabilize the child's condition before further assessment and investigation. Subsequent actions should include assessing vital signs and obtaining a detailed history. Question 11. A 6-year-old child with sickle cell anemia is admitted to the hospital with a vaso-occlusive crisis. Which intervention should the nurse include in the child's plan of care? A. Encourage increased oral fluid intake. B. Apply warm compresses to the affected areas. C. Administer intravenous iron supplements. D. Provide active range of motion exercises. Answer. A. Encourage increased oral fluid intake. Rationale. During a vaso-occlusive crisis in sickle cell anemia, there is a risk of dehydration due to increased red blood cell clumping and occlusion of blood vessels. Encouraging increased oral fluid intake helps prevent dehydration and promotes improved blood flow through the vessels, potentially reducing the severity of the crisis. Question 12. A 9-month-old infant is diagnosed with developmental dysplasia of the hip, DDH. Which intervention should the nurse anticipate in the infant's care? A. Encouraging crawling and standing activities. B. Placing the infant in a Pavlik harness. C. Applying cold packs to the hip joint. D. Performing hip abduction exercises. Answer. B. Placing the infant in a Pavlik harness. Rationale. Developmental dysplasia of the hip, DDH, is a condition where the hip joint is improperly formed or dislocated. The Pavlik harness is used to maintain the hips in a flexed and abducted position, promoting proper alignment and helping the hip joint to develop normally. Question 13. A 4-year-old child is admitted with a diagnosis of nephrotic syndrome. The nurse should assess for which characteristic manifestation of this condition. A. Hypertension and bradycardia. B. Proteinuria and generalized edema. C. Weight loss and dry mucous membranes. D. Decreased urinary output and dark-colored urine. Answer. B. Proteinuria and generalized edema. Rationale. Nephrotic syndrome is characterized by increased glomerular permeability, leading to significant protein loss in the urine, proteinuria, and low levels of protein in the blood. The decrease in oncotic pressure results in generalized edema, particularly noticeable in the face, abdomen, and extremities. Question 14. A 15-year-old adolescent with cystic fibrosis, CF, is admitted with a pulmonary exacerbation. The nurse should anticipate the need for which treatment? A. Initiating a low-calorie diet to prevent weight gain. B. Administering intravenous calcium supplements. C. Providing chest physiotherapy in aerosolized bronchodilators. D. Encouraging increased intake of dairy products. Answer. C. Providing chest physiotherapy in aerosolized bronchodilators. Rationale. Cystic fibrosis is a genetic disorder that affects the respiratory and digestive systems. Pulmonary exacerbations often require aggressive treatment to clear mucus and improve lung function. Chest physiotherapy, which includes airway clearance techniques, and aerosolized bronchodilators are commonly used to manage respiratory symptoms in CF patients. Question 15. A 10-year-old child is diagnosed with a urinary tract infection, UTI. The nurse is educating the child's parents about home care. Which statement by the parents indicates a need for further teaching? A. We'll make sure our child completes the full course of prescribed antibiotics. B. We'll encourage our child to drink plenty of fluids throughout the day. C. We'll give our child a warm bath every day to help with the discomfort. D. We'll switch to bubble baths to make bath time more enjoyable. Answer. D. We'll switch to bubble baths to make bath time more enjoyable. Rationale. In children with UTIs, it's important to avoid potential irritants to the urinary tract, including bubble baths, scented soaps, and other chemical agents. These products can further irritate the urinary tract and worsen the infection. The parents should be advised to avoid bubble baths and opt for simple, non-irritating soaps during bath time to promote healing and prevent recurrent infections. Question 16. A 3-year-old child is diagnosed with Kawasaki disease. Which clinical manifestation should the nurse expect to find in this child? A. Strawberry tongue. B. Pustular rash on the palms and soles. C. Dry, cracked lips. D. Koplik spots on the buccal mucosa. Answer. A. Strawberry tongue. Rationale. Kawasaki disease is an inflammatory condition that primarily affects young children. One of the classic manifestations is the appearance of a bright red, swollen tongue with prominent taste buds, resembling a strawberry. Other common symptoms include fever, rash, swollen hands and feet, red eyes, and swollen lymph nodes. Question 17. A 5-year-old child is hospitalized with acute asthma exacerbation. The nurse is preparing to administer nebulized medications. Which medication should the nurse administer first? A. Albuterol, short-acting beta-agonist. B. Ipratropium bromide, anticholinergic. C. Fluticasone, inhaled corticosteroid. D. Montelukast, leukotriene receptor antagonist. Answer. A. Albuterol, short-acting beta-agonist. Rationale. During an acute asthma exacerbation, the priority is to relieve bronchospasm and improve airway patency. Albuterol is a short-acting beta-agonist that acts quickly to dilate the airways and provide immediate relief from bronchoconstriction. Question 18. A 12-year-old child is admitted with a diagnosis of diabetic ketoacidosis, DKA. The nurse reviews the child's laboratory results and finds a blood glucose level of 450 mg per deciliter, 25 millimole per liter. pH of 7.18, bicarbonate level of 10 milliequivalent per liter, 10 millimole per liter. And a moderate amount of ketones in the urine. Which intervention should the nurse anticipate in the child's care? A. Initiating an insulin infusion. B. Encouraging high-carbohydrate meals. C. Administering sodium bicarbonate intravenously. D. Increasing the child's fluid intake with electrolyte replacement. Answer. A. Initiating an insulin infusion. Rationale. In diabetic ketoacidosis, DKA, the body produces high levels of ketones as a result of using fat for energy due to insulin deficiency. The acidosis leads to a decreased blood pH. The priority intervention is to initiate an insulin infusion to promote glucose uptake by cells and halt ketone production, thereby correcting the acidosis. Question 19. A 7-year-old child with cerebral palsy is nonverbal and has difficulty with mobility. The nurse is assessing the child's pain level. Which pain scale is most appropriate for this child? A. Numeric Pain Rating Scale, NRS. B. Visual Analog Scale, VAS. C. Wong-Baker Faces Pain Rating Scale. D. FLAC, Face, Legs, Activity, Cry, Consolability, Pain Scale. Answer. D. FLAC, Face, Legs, Activity, Cry, Consolability, Pain Scale. Rationale. The FLAC pain scale is commonly used for children who are nonverbal or have difficulty communicating. It assesses pain based on facial expression, leg movement, activity level, crying, and consolability. The nurse can observe the child's behaviors and assign a score to each category, helping to assess and manage the child's pain effectively. Question 20. A 14-year-old adolescent with cystic fibrosis, CF, is prescribed pancreatic enzyme replacement therapy. When should the nurse administer the enzymes? A. Before meals and snacks. B. After meals and snacks. C. With meals and snacks. D. 2 hours after meals and snacks. Answer. A. Before meals and snacks. Rationale. Pancreatic enzyme replacement therapy is essential for individuals with cystic fibrosis because CF affects the pancreas and impairs the production of digestive enzymes. The enzymes should be taken before meals and snacks to aid in the digestion and absorption of nutrients from food. This helps prevent malabsorption and nutritional deficiencies commonly seen in CF patients. Question 21. A 2-year-old child is diagnosed with Hirschsprung's disease. Which clinical manifestation should the nurse expect to find in this child? A. Profuse, watery diarrhea. B. Severe abdominal pain and distension. C. Painful urination with hematuria. D. Frequent episodes of vomiting. Answer. B. Severe abdominal pain and distension. Rationale. Hirschsprung's disease is a congenital condition characterized by the absence of ganglion cells in parts of the colon, leading to a functional obstruction. The child may experience severe abdominal pain and distension due to the buildup of stool and gas in the affected area. Question 22. A 6-month-old infant is scheduled for a cleft lip repair. Before surgery, which intervention should the nurse prioritize? A. Encouraging the infant to drink from a sippy cup. B. Positioning the infant on the side to prevent aspiration. C. Administering analgesics to manage pain. D. Implementing measures to prevent crying and agitation. Answer. D. Implementing measures to prevent crying and agitation. Rationale. Before cleft lip repair surgery, the nurse should prioritize implementing measures to prevent crying and agitation to minimize tension on the suture lines and reduce the risk of postoperative complications. Comfort measures and non-pharmacological pain management techniques are essential in the preoperative phase. Question 23. A 10-year-old child is admitted with suspected rheumatic fever. Which laboratory finding should the nurse expect in this condition? A. Elevated erythrocyte sedimentation rate, ESR. B. Decreased white blood cell, WBC, count. C. Elevated platelet count. D. Decreased hemoglobin level. Answer. A. Elevated erythrocyte sedimentation rate, ESR. Rationale. Rheumatic fever is an inflammatory disorder that can develop after an untreated or inadequately treated group a streptococcal infection, strep throat. The ESR is often elevated in cases of rheumatic fever, indicating an inflammatory process in the body. Question 24. A 5-year-old child is brought to the emergency department with a suspected foreign body aspiration. Which intervention should the nurse prepare for initially? A. Chest X-ray. B. Bronchoscopy. C. Nebulized bronchodilator therapy. D. Chest physiotherapy. Answer. A. Chest X-ray. Rationale. A chest X-ray is the initial diagnostic tool used to determine the presence of a foreign body in the airway. It helps visualize the location and extent of the aspiration and guides further interventions. Question 25. A 16-year-old adolescent with sickle cell disease is prescribed hydroxyurea. Which statement by the adolescent indicates an understanding of the medication teaching? A. I'll take this medication only when I'm experiencing a sickle cell crisis. B. I should expect my skin to become pale and yellow while on this medication. C. I'll use birth control while taking this medication to prevent pregnancy. D. I should increase my intake of iron-rich foods while on this medication. Answer. C. I'll use birth control while taking this medication to prevent pregnancy. Rationale. Hydroxyurea is a medication commonly used to reduce the frequency and severity of sickle cell crises. However, it can cause harm to a developing fetus, so it's crucial for females of childbearing age to use reliable birth control methods while taking this medication.